Welcome to Guardian Stars platform. Welcome to my presentation. In this short presentation, I will discuss psychiatric institutionalization. My name is Mulundano. Let's begin by defining what institutionalism is for us to understand what it is exactly. So the definition I have here is that institutionalism is a pattern of passive dependent behavior observed among psychiatric inpatients, which is characterized by hospital attachment and resistance to discharge. From this definition, what we can simply get is that the condition itself, which is institutionalism, occurs in patients who have stayed in the hospital for some time. Okay, so this is a condition that is observed among patients who have been admitted in a psychiatric institution, and the patient who is admitted in a psychiatric institution, when time comes for discharge, they may refuse to go home. Sometimes they may go home but will return to the health facility within a few days after discharge, before their time for review comes. Long-term admissions in mental institutions leads to a condition called psychiatric institutionalism. Of course, this is just an addition on what institutionalism is. So one of the contributing factors to institutionalism is long-term admissions to mental health institutions. We know psychiatric mental illnesses are usually chronic conditions and not easily treated, and most of the patients stay for a very long time in an institution. So that long-term stay is one of the contributing factors to the condition. Let us look at some of the signs and symptoms of institutionalism. So we have dependence as one of the signs and symptoms of institutionalism, and lack of initiative, inability to solve problems, not able to make decisions, not able to live outside the mental institution. So for dependence, this one can be seen when patients are unable to decide. They are unable to make decisions on their own, so they end up depending on health providers, on healthcare providers like nurses or anyone who is attending to them, to make decisions or to decide what to do. So they depend on the healthcare facility, on the healthcare system or healthcare members for everything that they want. They can't decide on what to do on their own. Okay, usually patients will develop this kind of dependence syndrome when we as healthcare providers are ignoring their efforts to decide and make contributions in relation to their own treatment and care. So as you ignore them, they'll feel that their contributions are not important, they're not necessary, so they'll start depending on you for a decision making. Then lack of initiative. The patient has no ability to decide what to do next and to do it without needing other people to tell him what to do next. Alright, so for example, if a client takes a bath by showering, he will not have the initiative to bath using a bucket when water is not flowing from the shower. Okay, so they usually do not have that ability to decide what should they do next when the first option fails. Inability to solve problems. These could be very simple problems that they can easily solve, that we expect them to solve on their own. So they'll instead fail to solve such simple problems on their own. And usually the client shows apathy and lack of effort in sorting out such simple challenges that they face. Okay, and not able to make decisions. The client cannot make a choice about something after thinking about several possibilities. Not able to live outside the mental institution. Okay, so sometimes patients may actually go home after discharge but will return to the health facility within a few days because they are not used to staying outside the health facility. They are not used to living at home. Okay, So these are a few causes that I have mentioned in this presentation, but there are some more causes that I have left out. I just thought these were the most important ones that you need to know as a student. So the first one on my list is scheduled daily activities, and we have patient locked up from the outside world for some time, of course, a mortification of self, carrying out activities in groups, and possible intimidation by healthcare providers, and stigma, restriction of freedom. These are some of the causes of psychiatric institutionalism. So how do they lead to institutionalism? How can this make a patient become institutionalized? Okay, so for scheduled daily activities, when a patient gets used to having his day planned for by healthcare providers, he will not put in that effort. He will not be worrying about anything, because he knows that his day is already covered. He does not put in any effort into planning for what he has to do on his own. When patients are locked up from the outside world for some time, they tend to get so used to living indoors, so used to living in the psychiatric institution, and they never look forward to going outside the psychiatric institution. Okay, so sometimes they just develop that fear of the unknown. They fear how the outside world will receive them when they get out of the psychiatric institution. Mortification of self. Some patients just look down upon themselves because they feel they are useless, they feel they are not important. Okay, so they just tend to look down upon themselves, and that will make them become dependent and become institutionalized. Carrying out activities in groups. When we give our clients some tasks to do as groups, patients become so dependent on other people as well, and they cannot carry out tasks on their own. They cannot carry out some activities as individuals. We need to avoid giving most tasks in groups. We have to give them as individuals as well, so that patients can do things on their own, can be trained to do things on their own. Possible intimidation by healthcare providers. Sometimes it's us as healthcare providers who will make our patients become institutionalized or dependent on us. When you shout at the patients whenever they try to make a contribution, whenever they try to express themselves, you shut them down. The patients will become so scared of expressing themselves, and they'll become dependent on you as a healthcare provider. Stigma also. This stigma could be from the community and the family members. If the patient knows, because patients know how the community looks at them and how the community treats them, so the stigma that patients suffer in the community will usually make them desire to stay in the healthcare institution, in the psychiatric institution, no matter how long it takes. Because there they feel so safe and comfortable, because they find people who understand their situation. Restriction of freedom. When you do not allow clients to do things on their own, to decide on their own, you have limited their movements. They feel like prisoners. They become confined to that health facility. They just feel they cannot do anything else apart from doing what you want in that healthcare facility. They become scared of doing things on their own, because you have put a lot of restrictions on them. So we need to note that when patients become dependent on health professionals, they become helpless, mistreated, and exploited by the health professionals. So when patients become institutionalized, they usually become helpless, they become mistreated, they are easily mistreated and exploited by health professionals. So you need to look at how can a healthcare provider mistreat or exploit patients who are institutionalized. How can these patients be exploited by healthcare providers? One of the ways in which patients can be exploited is imposing treatment on the patients. You know, patients have the right to know what kind of treatment you are giving them, and most of the time as healthcare providers we tend to impose treatment on patients. We do not explain what we are administering to patients. We do not explain the kind of care that we are giving to the patients. We just decide for them, okay, because we feel their decisions are not important in this case. So that attitude of imposing treatment on patients and not explaining their condition, it's exploitation. It can be explained as mistreatment and exploitation of patients by healthcare providers. Okay, patients have the right to know what kind of a condition they are suffering from and the prognosis of the condition, but we usually ignore that information most of the time. Alright, so when you are required to explain how you can prevent psychiatric institutionalism, you just have to identify the causes. When you identify the causes, then you counteract those causes. Okay, you put in some interventions against each of those causes that you have identified. So in the previous slide we looked at the causes, so you just have to put in some measures against those causes that we have identified. Then you are going to successfully prevent your patients from becoming institutionalized. Thank you so much for listening. Thank you so much for watching, and please remember to subscribe to our channel.